Now here we have the anatomical position. The anatomical position is the standard reference position of the patient. So when we want to study anatomy, any kind of anatomy, we have to be referred on this position, which what we call anatomical position, which is the standard reference position of the patient. Next we have the anterior aspect of the body. The anterior aspect of the body is the front view of the body or the patient. So when we have a patient positioned like this, we call it the anterior aspect of the body. When we have the front view of the person or the patient. Next, here is the posterior aspect of the body. The posterior aspect of the body is the back view of the patient. So when we have this view, when we look the patient from the back side or from the back view, we call it the posterior aspect of the body or the dorsal aspect of the body. Next, we have the lateral aspect of the body, which is the side view of the patient. So when we look a patient from the side, we call it the lateral aspect of the body. Here is the major aspect of the arm. Generally, the major aspect refers to the side of a body part closest to the midline. The major aspect refers to the side of a body part closest to the midline. So here, for example, we have the major aspect of the arm. In that image, we can see both the major aspect and the lateral aspect of the arm, but I want to emphasize here just the major aspect. Okay. We talk about the anatomical or the anatomical terminology. Then we will resume it like this. Let's resume it like this. Anatomical terminology. We talked about the anatomical position. We talk about the anterior aspect of the body. The posterior or the dorsal aspect of the body. The lateral aspect of the body. And the medial aspect of the body. We defined all that. We defined the anatomical position, the anterior, the posterior, lateral, and the medial. Now let's talk about the positioning terminology. Positioning terminology. Okay. There are also positioning terminology and projection terminology that you need to know to be able to perform an X-ray examination. Okay, in the positioning terminology, we study firstly the different planes of the body. So firstly we study the different planes of the body. We write it, the planes of the body. Okay, as the planes of the body, we have the median sagittal plane, the median sagittal plane, the median sagittal plane, which divides the body into right and left halves. The median sagittal plane divides the body into right and left halves. Right and left. The body into right and left. Or we can also call it simply the sagittal plane. We can have it, you can see it in the image below. You can call it the sagittal plane, which divides the body into unequal right and left portions. Unequal right and left portions. This is the sagittal plane. But when we talk about the median sagittal plane, is when the plane or the line divide the body into right and left halves. Okay. We also have the coronal plane. The coronal plane. The coronal plane, which divides the body into anterior portion and posterior portion. Anterior portion and posterior portion. You can see it in the image below. We also have the transverse or axial plane. Transverse or axial plane, which divides the body into its superior and an inferior part. It divides the body into its superior and inferior part. Okay. There are many types of position that the patient can take for the various radiographic projections. So then we write positions of the patient, the men's positions of the patient. We are always in the positioning terminology, so don't be confused. The men's positions of the patients are the erect, erect, the erect position, and the decubitus position. So let's write first the erect position. The erect position is when the patient can be stand. The patient is maybe standing or sitting, which the posterior aspect or the anterior aspect or the lateral aspect against the cassette. That's what we call erect position. Erect position. You can have it here. You can see it here. For example, we have the patient standing with the anterior aspect of the thorax against a vertical bucky. That's what we call erect position. And next we have the decubitus position. Decubitus position. Here the patient is lying down. He is lying down on supine. Lying down in supine or in prone position. Supine means dorsal decubitus and prone means ventral decubitus. The patient can also be lying on the side. We call it lateral decubitus. So here we have supine, prone, side or lateral. Also have semi-recumbent. Semi-recumbent. Supine means dorsal decubitus. Prone means ventral decubitus. Lateral means simply on the side, the patient lying on the side. Semi-recumbent means is when the patient is reclining partway between supine and sitting erect with the posterior aspect of the trunk against the cassette. That's what we call the semi-recumbent. The semi-recumbent. You have it here. Okay, here we have some image of supine and prone. For example, we have a patient in the supine position with the median sagittal plane at the right angles to the table and the coronal plane is parallel to the table. In the second image, we have a patient in prone position. The median sagittal plane is at right angles to the table and the coronal plane is parallel to the table. Next, we have the left lateral decubitus. The patient is lying on the left lateral decubitus. It means the median sagittal plane is parallel to the table and the coronal plane is perpendicular to the table. Next example, we have right lateral erect. A patient in right lateral erect position. The patient is standing with the right side against a vertical bucky. That's how we see. And we have the semi-recumbent. The patient is she is lying semi-recumbent, with posterior aspect of the thorax against the cassette and the median sagittal plane perpendicular to the cassette. That's what we see. Okay, we will end here with the the first presentation of this introduction of X-ray basics lectures. Uh, there is too much to say. There's too much. So in resume, we have here's what we have seen today: the anatomical terminology, and we have started the positioning terminology. The next time we will continue with the positioning terminology of the limb, and next with the projection terminology, and we also learn some bones anatomy of the bones, the parts of the bones, the very important parts of the bones, because if we want to learn about X-ray exam, we have to know, to understand or know the most part of the human bones, skeletal. So we have to learn about it. So thank you for watching this, and let's see for the next lecture.